Kas is a word used to describe cough or act of cough in Ayurveda. Bouts of cough coming out either in dry or with phlegm is called cough. Cough is a symptom and is found in many diseases. When it gets independently manifested, having its own pathogenesis, it will be considered as a disease. When cough is a disease, it will have its own etiological factors, premonitory symptoms, subtypes, symptom complex, prognosis, and treatment principles. Causes of cough: smoke entering the mouth, nose, throat, etc. Exposure to dust, excessive physical exercise, excessive consumption of dry foods, entry of food particles into the respiratory passages, forcibly stopping the natural urges of the body, especially that of cough and sneeze. There are 5 types of cough mentioned in the ancient books of Ayurveda, namely Vataja, Pittaja, Kaphaja, Kshataj, and Kshayaja cough. Premonitory symptoms of cough: the person feels as if his throat and mouth are filled with spicules. There is itching in the throat and obstruction to the passage of food. Pathogenesis of cough: the vayu obstructed in the lower portion of the body moves upward and gains entry into the upper channels of the body. On reaching the upper portion of the body, the vayu gains the form and behavior of Udanvat. It is a type of Vata which tends to have movement in an upward direction. Moving upwards, it gets lodged in throat and chest. It also reaches into the channels of the head and fills up all these channels. It breaks and seizes the body, jaws, and eyes. The vayu further bends and distorts the eyes, back, chest, and flanks, and also causes stiffness and immobility in these structures. Following this, the cough is produced in a dry form or along with sputum. The disease in which the bouts appear in a contemptible form is called as cough. Prognosis: the Vataja, Pittaja, and Kaphaja types of cough are curable. Kshataj and Kshayaja types of cough are manageable. They can't be easily treated like the doshic types. Therefore, they need to be managed with suitable diet and lifestyle modulations. All types of cough caused in old age due to the effect of aging process are manageable. When the 5 types of cough are neglected, they lead to deterioration and destruction of the body, may eventually lead to death. Treatment of wet and dry cough: in wet cough, mucus or phlegm is produced. Here, foods and drinks which are drying in nature should be administered. In cough caused by kapha dosh, if there is association of Pitta dosh, foods predominantly prepared with bitter things should be given. In dry cough, there is no expectoration of phlegm. Here, lubricating or unctuous foods and drinks should be administered. Treatment principles for different types of cough: in Vataja cough, treatment principles are oleation, sudation, oil or lubricating enemas, oral consumption of ghee after food, lubricating purgation medicines, medicated smoking, etc. Useful medications are Kantkari ghee, Rasnadi ghee, Agastya haritaki, etc. In Pittaj cough, treatment principles are drinking of emetic ghee and causing vomiting in greater association of cough, purgation in lesser association of cough. Useful medications are Shringatakadi le, Pipalyadi le, Sthiradi Kshirpak, etc. In Kaphaj cough, treatment principles are emesis, cough destroying foods, medicated smoking, etc. Useful medications are Katphaladi Kvat, Nagaradi Yog Pipli, Kantakari ghee, etc. In Kshataj cough, treatment principles are medicines predominant with sweet taste, Jivaniya group of medicines, Balya or strength promoting group of medicines, muscle enhancing medicines, treatment mentioned in Pittaj cough, medicated smoking, etc. Useful medications are Pipalyadi Sneh, Jivaniya ghee, milk, honey, use of meat, etc. In Kshayaja cough, treatment principles are mild purgation, unctuous enema, wholesome diet, consumption of meat and meat juice, medicated smoking, alternative use of appetite enhancing, bulk promoting and cleansing medicines, strengthening medications and food. Useful medications are Dashmuladi ghee, Guduchyadi ghee, Haritaki avle, Jivantyadi avle, etc. Wholesome diet and habits for cough. One should take sudation therapy, therapeutic emesis, nasal medication, therapeutic smoke inhalation, therapeutic purgation, sleeping, unctuous and soft food, salt, old horse gram, wheat, rice that is harvested in 60 days, barley, meat of blackbuck, partridge, hot water, citron fruit, pointed gourd, tender radish, ripe wood apple, honey, etc. Unwholesome diet and habits. One should avoid cowpea, black gram, oil cake, meat of aquatic animals and animals living in marshy lands, milk of sheep, toothbrushing, enema therapy, fish, mustard, sour substances, bottle gourd, oil, fried substances, spinach, foods which have heavy and cold qualities, etc. These are the herbo-mineral compounds useful in the treatment of dry or wet cough under the guidance of an authentic Ayurvedic physician. Hope this information brings health in your life. Thank you.